I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client has significant scoliosis and in fact wears a scoliosis brace. And she's come to see me because she's aware of asymmetry of her pubic joint and she feels like she has sacroiliac joint dysfunction among a few other things. And I do in fact find a step off. Start from the belly and work your way down, and then you can encounter the top of the pubic bones, and they are symmetrical at the top. But as I palpate down the length of the pubic bones, the left side is more posterior, okay? And when I slide from the right to the left, I fall down. When I go from the left to the right, I climb up onto the right side. And so I agree that there is a posterior shift of the pubic bone. Now the other finding is it appears as though her pelvis has normal movement with spring testing, except that when I push here I immediately observe the other side lift up. Okay? And when I take up the slack out of the system and then spring, there is movement and there is a gentle recoil. But this is a false positive. And I didn't know that it was a false positive until I had her on her stomach, which I'll do shortly. Also note that there's no right to left pelvic side glide. And if I try and push left to right side glide, there's no movement there. Let's have you lie on your stomach. Now, in contrast to the spring test that we did with her on her back, when I try to do spring tests with her prone, there's no give at all. Trying to push superiorly, trying to spring the ischium, there's no give. Trying to spring the sacrum, there's no give. Trying to get inferior glide, there's no give. And this case is the most prominent sacrum I've ever seen. My left thumb is on her PSIS, part of the ilium, that little bump. And then my other thumb is on the sacrum. And there's a considerable difference in the height of those. And maybe it would be better if I did that on the other side, I don't know. What I think I'd like to do is drop that camera and get a pure lateral shot. So bear with me, please, while I drop this camera down.
Okay.
And you can see that she's got tape on her back. So here's palpation of the left PSIS, and here is sacrum. And here's palpation of right PSIS, and here is sacrum. This is a pattern that I discovered in addition to that pattern on the pube because it's not described in the literature on sacroiliac joint dysfunction. The pattern of the sacrum being posterior, I've named it a posterior glide fixation of the sacrum, and it basically wedges the sacroiliac on both sides and eliminates passive movement in every direction. So the goals of treatment are to glide the ilia back, posterior and posteromedial, and then glide the sacrum anteriorly. So I put foam under each side of the pelvis, 2 inches tall by 4 by 8 inches. And she lays like that for 5 minutes. Then I add an additional 5 minutes of posterior to anterior pressure on the sacrum. And I do that for 5 minutes. And that should restore mobility and appropriate positioning of the sacroiliac joint. And should restore movement throughout with all of those spring tests. I'll do a separate treatment. So I'm putting the foam underneath her pelvis right now. And I'll do a separate treatment to treat the asymmetry of the pubic joint. But anyway, I'll stop filming here and we'll refilm after I finish treatment.